Hey guys, it's Dr. Abraham with A Sip of Aesthetics. Today we have a special guest. We have Lindsay with us here.
Yes, thank you for having me back.
Of course. And we're talking about cellulites today and different treatment options. I know this is a topic that a lot of people are interested in. And luckily, as you're going to find out in this episode, there are certain things you can do to help improve the appearance of cellulites. Am I correct?
Yes.
Awesome. Let's jump in. What are cellulites and why do people get them?
Yes. So true cellulite is kind of a multifactorial situation where you have genetically, some people have them more than others, but they're called fibrous septae. They're basically little fibers under the skin that kind of tug on the skin. And all around the fibers are subcutaneous fat tissue. The legs in particular, especially over time, have kind of degrading circulation and lymphatic flow. Okay. And so over time, the circulation and the lymphatic process in the leg gets poorer and poorer. And so fluid gets stuck because of gravity. Fluid gets stuck in the thighs, in the fat, kind of bogs down the fat, almost makes the fat look larger. And in between the fat cells are these fibrous septae. So suddenly you'll develop like these dimples. And some people have dimples earlier in their 20s. And some people just gradually notice them more as their body is changing and aging. So really cellulite is hard to tackle because sometimes it involves addressing the lymphatics, the circulation, and treating those little fibers that are tugging the skin and dimpling the skin. Some people come in and they say, oh, I have all this cellulite, and you look at their skin and it's truly mostly skin laxity. And so that's another thing that happens as you age. You're losing collagen, elasticity, firmness in the skin. And suddenly the skin, partly because of gravity, just looks kind of uneven, not smooth, not glowy, and has kind of irregular texture to it, but isn't necessarily cellulite.
Gotcha. So just to make sure I understand, so a true cellulite is going to have these fibrous septa that are pulling down on the skin and creating these actual true dimples in the skin caused by the fiber. There's a lot of things, as you mentioned, going on, but the fibrous septa is like one of the main things. Whereas somebody else might have that kind of unevenness in the skin, but if it's more loss of elasticity, it's not because there's that fibrous septa that's pulling down, and it's more skin changes. And both of these things, maybe there are treatments for, but just it's going to be a completely different approach if you're treating a true cellulite versus something else. So is cellulite is going to pretty much look the same on everybody? And how would you approach it if somebody has like, is it always only cellulite or only the skin laxity, or is it a combination of both? How would you like start by when you meet a client?
Yes. If it's a young person, say in their 20s, early 30s, who has great skin quality, but truly has just those like big septae with the big dimples, you can just approach them by treating the cellulite. But over time, if somebody wants to treat the thigh, almost always you're doing a combination of treating the skin laxity, so improving the skin quality, and treating the dimples if they have true cellulite.
What are some treatments for cellulite and some treatments for skin dimples? Maybe we can just mention them and then we can go a little bit deeper into each one.
Cellulite or like thigh treatments can be frustrating because it's kind of a never-ending battle, and you'll all continue to age, your lymphatics, your circulation continues to age too. And so for a long time, there were these procedures that just kind of promoted the circulation and the lymphatics. But people would get frustrated because they would have a good result and then 6 months later kind of be back to where they were. And so I tell patients that if they want to address the thighs, really just plan on doing something maybe once a year at least to kind of just preserve the skin quality, and plus or minus topical treatments. The actual cellulite treatments don't necessarily need to be done often. Once those fibrous septae are either cleaved or dissolved or whatever the treatment is, they don't necessarily come back. You'll see newer ones as you age and as time goes on, your body forms new finer ones, but sometimes those are like a 1 to 2 session treatment, and then they might not treat the actual cellulite again for years, whereas the skin is like yearly.
Gotcha. So you have to make sure you're actually going at the septa. You used two words there that I want to zoom in. You said cleaved or dissolved when you were referring to the septa. Can you talk a little bit more about that?
Yes, there was a product called Quo that we used heavily and got great results from. However, it was a solution that was made to target the collagen and break down the collagen that makes up the fibrous septae. So you
Gotcha.
would kind of pinpoint where the cellulite was. You would inject right into the cellulite. And the process was that that solution would then dissolve the septae and release that septae.
Awesome.
The problem was that similar collagen that creates a septae also creates the blood vessels within the septae. So it would not only dissolve the fibers, but it would dissolve the veins and the arteries around the area, and people would bleed and bleed and bleed from these procedures. And you can bleed from any cellulite treatment, but this one had significant bleeding and would result in hyperpigmentation or just prolonged healing. Sometimes 9 to 12 months later, they would still have darkening of their skin or bruising because of those damaged vessels.
So you would see the great results with the cellulite, but just the healing can be pretty
Yes.
prolonged, and the bruising can take a long time to heal. What about the cleave? Cutting those septa.
Especially in larger septae, there still is a little vascular structure in there, but you can use, it's called subcision, where you basically go in with a blade. This has been practiced for a while, but now there's an actual device called Aveli that you can use to target those septae and basically cleave or cut the septae so that they're released from the skin. And it works great. You still have some bruising, but it seems quite a bit more manageable compared to Quell.
Gotcha. So now you're going in and you're actually mechanically cutting the septa, allowing the skin to release.
Yes.
It's awesome.
Yep. And it works great. I've already treated some patients that have wonderful results.
And is it a one-time treatment thing with that one usually, or do you have to kind of like keep repeating it?
If you have multiple true cellulite spots, sometimes I break it up so that they don't have as much downtime. And then you use quite a bit of numbing solution during the treatment. So sometimes we'll focus just on like the buttocks area, or we'll do the back of the thighs, come back, we'll do the front of the thighs, or wherever we need to do. And patients tolerate it well. It works great. And you might need to do sections at a time. If they have a lot, you might do a second treatment in the same area. But then once you complete that procedure, most patients don't come back within like 3 to 5 years to repeat it. I like Aveli. I always say Aveli. Ovally. But I like that procedure because you directly pinpoint the fibrous septae and you're mechanically kind of feeling the tethered down skin, and you can feel when you release that septae. Whereas some of these other kind of ultrasound or other type of technologies are not as strong typically, or you might need this whole series of treatments and can, in theory, reduce the septae or kind of break up the septae, but more so are working on some of the lymphatics and circulatory processes that contribute to.
Awesome. So you mentioned also that sometimes you combine the septa treatment, if you will, with treatments to help improve the tightness of the skin. So what kind of treatments are we talking about in that case?
I just did a treatment like this today. I used radio frequency microneedling called Scarlet in our office, and that basically kind of helps deliver some energy into the skin via microneedles that will firm up the existing collagen and create these open channels. And after the treatment, I applied a PDRN, which is the salmon-derived growth factors, so that we could kind of optimize the tissue healing, the circulation to the thighs, and just kind of max out our potential for wound healing and tissue regeneration.
That's awesome. And I know you've also, correct me if I'm wrong, but you also like, that is a great option, but there are other options that I've seen you use before. Like I think Endolift was one of them,
Yes.
and even Radiesse sometimes, and
Yep.
things like that.
Endolift, this term is horrible. It's called elephant knee. But if somebody has quite a bit of heaviness above their knee with just like some excess subcutaneous fat or bogged down fat, you can use Endolift to tighten the skin, but also reduce the amount of superficial fat that's contributing to the unevenness and the unwanted appearance. And then I also love to inject like a diluted Radiesse occasionally into areas that used to have the big tethered down cellulite, because you can kind of expand that tissue a little bit and start stimulating some new collagen or new tissue growth where it had been like indented basically for years.
Awesome. I always love having you just because you're full of information and you know so much. And I like
could
how you
talk
share
about
it with
this all
everybody.
day.
No, thanks a
you.
lot for coming. For sure, make sure you come back next time. And,
Yes.
you know, we can talk about a lot of other, I know you're so knowledgeable on so many different topics.
I love talking with you about this.
Thank you. Make sure you guys, like and subscribe so you can see me and Lindsay again talk about whatever topic you guys want us to talk about. Leave us a comment, send us a message, and we'll see you guys next week.